Hi, this is Trevor. I'm doing the newborn physical assessment here, and I don't have any stuffed animals or real babies, so I had to use this baby, which is a ukulele. And for the purposes of this test, I know it's not ideal, but this is the head of our newborn. In fact, let me move it right there. And this is their awesome hair. See that? And then here's the body. The head will be here. The body's here. The arms coming off, legs coming off, and so forth. So the first thing I'm going to do when I'm entering the room, I'm going to knock before entering and ask if I can come in. And then I'm going to explain what I'm doing there. I I'm going to tell them, hi, I'm Trevor. I'm here to do a newborn physical assessment. I'm going to make sure that there's privacy for the assessment. I'm going to wash my hands, and I'm going to be observing for bonding between the parent and the baby. You know, are they breastfeeding, or is there like formula being fed right now, and so forth. And then I'm gonna wash my hands, and then I'm gonna don clean gloves. And I'm going to check I'm gonna see if the parents, if they're have any questions or concerns, are they accepting the gender of the newborn. I'm gonna clean my stethoscope. So let me do that. Da-da-da. Got my stethoscope, got it cleaned. Have that on my ears hanging, ready to go. And then, so we're moving forward, and I'm checking now the wristband of the baby. I'm checking it to mom, making sure that those match. And I'm gonna carefully pick up the baby, and I understand that there would be like a scale in the room that I can use, so I can carefully place the baby very safely, never taking my eyes off. And we're going to weigh the baby, and then we're going to measure length as well. So let me do that. Put this away. And so we're going to be thinking in terms of gestational age. Is this average, large, or small? Is the infant, length and weight? Is it within normal parameters, and so forth? And then we're moving on to the head. So first I'm just observing. At all times I'm looking for symmetry. And is anything asymmetrical? Is there any lumps, bumps, or bruises? Same as with a adult head to toe. So that kind of transfers to this. It's not all that different. I'm looking at the head, and I can explain. You can see here that there's some pretty significant molding, if you like. It's molded into this beautiful head right here. And I would just tell the parents that that's totally normal. And let's say for this instance that this was the mother's first baby, I would explain that with the firstborn child, that molding can be a little more extreme, and that will go away, and that will have a normal shape within a few weeks. So then I'm noticing the fontanelles, and I'm seeing that the anterior one has the typical diamond shape, and that the posterior is going to have that triangle shape. Everything is as it should be. Like I mentioned, beautiful blue hair on this particular girl. So let's go with girl. Then we're moving on. I'm looking at the face in the same way. I'm looking at the face and the eyes and the nose. I'm looking at the integrity of the skin. Is there symmetry? Is the baby's eyes equally dilated? Perla, etc. Looking at the nose and mouth. Is there any maybe discharge from the nose? Careful not to shine into the baby's eyes, but just looking up the nares, making sure everything is as it should be, no discharge, or making sure that they're open. So moving down, looking at the mouth, the same thing. I'm looking for the midline. Is there anything asymmetrical, etc.? Is there like a runny nose or anything like that? So keeping moving on. Is there a cleft palate or anything of that nature? Let's say there wasn't in this instance. Tongue. Is the tongue protruding? Does the baby look like excessively dry or wet in the mouth and nose and eyes? Is there discharge and all? Then I can look at the neck right here. Let's say this is the very long neck. Are the clavicles present? Are they equal? Can they be moved in a normal way? Nothing out of the ordinary with that. So going to move forward. Looking at the chest, we're looking for symmetry. Is there convex or concave? which doesn't necessarily imply a genetic issue if there was, but I understand that that can be there. So we want to look for that. We're looking at the nipples. Are they as they should be? Let's say about here. And then this is a good time to now listen to lung sounds. So we're going to get my stethoscope that I cleaned, and I'm going to use the bell, of course, and we're going to listen to the 6 spots. Yes. Let's go here, actually. Very good. Yes, yes, yes. Beautiful. Cool. So that was the front. I'm going to turn the baby over and do the same on the posterior side. There's going to be 6 spots that I'm listening to. I'm not hearing any, crepitus or crackling or wheezing or anything like that. I'm listening for normal, much more high pitch lung sounds. All right, did all that. The rate and the rhythm too. Is this a normal breathing pattern? Is there any labored breathing and so forth? Now let's move on to the abdomen. Let's just say it was about here. The abdomen, is it flat? Again, convex or concave? We want to see that, just like in an adult, that there isn't any labored breathing and that it was not protruding too much. And so we're going to start in the right lower quadrant to the upper, left upper. Okay, sorry about that. Ran out of room and had to break this into 2 parts. So where I left off, where was I? Was on the abdomen, basically looking at the, let's say this is the abdomen. I'm looking, is anything concave or convex? Is the baby's, abdomen flat? And I'm going to notice the cord stump and just make sure that that's clean and not red or looks like, there's any discharge or any issue like that. And then I'm going to take a listen here. So I'll start in the right lower, right upper, left upper, left lower. I'm listening for just normal bowel sounds or lack thereof. And then so at this point, it's a good time to look at the extremities. And basically I'm looking at symmetry of, let's say the arms are here, the legs are here. I know this is missing some key parts here. But extremities, I'm looking, can they move? Are they able to move in a normal way? Is there any crying or pain or any inability to move the foot and leg and hip? And we'll get more into that right now. Counting fingers and toes. Do I have 5, 10 fingers, 5, 10 toes? And then I'm going to want to come around here and before I leave the upper extremities, I can look at the palm and I can look for the simian crease. If we have the one singular line across the hand, that could tell us that maybe something's going on, maybe a genetic issue or like a Down syndrome kind of thing, but it doesn't necessarily mean that's happening. But that does need to be investigated further if we were to find that. So let's see, let's move to the lower extremities. We're going to do Barlow and Ortolani. So Barlow, I'm going to take the baby's legs and bend them up towards her chest here and just see that there's no issue. And then I'm going to get a little closer and spin outward and pull just to see, this is the Ortolani, to see if there's any issue with the pelvis and hip dysplasia. So no issue there. Counted fingers and toes. Moving on here, we can look at the brachial pulse, and you can also go right here where the legs sort of come out of the torso, and you can look for the femoral pulse. So we'll do that there. Then we're going to move on, and so like I said, this is female, so we're going to look at the vagina. We're going to be looking, I'll use my light, we're looking for, the labia majora and labia minora, the clitoris. We're going to look at baby's bottom too and just make sure that normal meatus is there. So I understand that that can be closed sometimes on birth, so we want to check for that as well. And let's see, back around here. So actually it's a good spot. So I'm going to turn the baby over And I'm going to look at her spine. I'm just looking for symmetry again, making sure straight spine, and looking at also the skin while I'm back here. Wanting to see, is there lanugo, like a little baby hair kind of growing? I could explain to the parents that that is normal. If anything, it's to just keep them a little warmer, and that will go away with time. Looking for Mongolian spots, anything like that, trying to explain. Looking for the gluteal crease, seeing that everything is there, and like I said, just kind of looking inside without being intrusive. So also, again, looking at the skin while we're back here, it's a chance to check for acrocyanosis and see if there's any signs of bluing or anything like that. Looking for nevus flammeus, nevus vasculosus, erythema toxicum, and so forth. And now's a good time. We're going to turn her over right here and do the reflexes. So one that we can do is by carefully cradling the baby, we can do the Moro reflex and see, does she instinctually reach out and sort of try to protect herself from, a simulated fall. So that's one that we can do right there. Put that nice hair back there. Another one we can do is the palm or grasp. So we'll put our finger into the baby's palm and just have her, she'll naturally kind of grip it. And another one we can do while we're down here is with the Babinski, we can get the bottom of the foot and just stroke the bottom of the foot and see that the toes kind of flare out and curl a bit. So that would be the ones I would do. Also, overall, indicators for the gestational age that can sort of tell us if they're normal for gestational age would be weight, length that we measured, head circumference you have to measure, vital signs that we've been taking as we do this, and also those reflexes. So I chose those three as the reflexes. So other than that, I guess I would just ask the parents if they had any questions for me. I know there's always questions and concerns, and I would just try to explain as best I know. That's it. Thank you.